So a question I often get about the Spine Specialist robotic laser-enhanced spinal decompression system is, hey, you're not even true spinal decompression. Wow. You know what my answer is to that? Absolutely, we're not true spinal decompression. Do you know why? Because true spinal decompression is a marketing term created by a couple different companies. They did it brilliantly, by the way. My hat's off to them. It was amazing. True spinal decompression gives the impression that it's the only thing that works because it's true spinal decompression. Everything else is false then. Amazing marketing job, but it just isn't the case. There's lots of spinal decompression companies out there with devices that aren't true spinal decompression that do phenomenal work with patients. And you know what? Even the companies that created this term, their machines are great. They help a lot of people. But I get hit all the time on, yours isn't even true spinal decompression. Well, yes, you're right. It's not. It's something better. Something different. Why would I do anything if it's not different, quite honestly? So I'm going to explain to you why, briefly here. So true spinal decompression, they say, and this is the one thing that kind of gets me about the whole scenario of true spinal decompression and having to entertain the question of, or entertain the comment that you're not true spinal decompression. I'm glad I'm not, because I came up with a different concept. True spinal decompression says I can isolate. This is a spine, let's say here, this rope, this yellow nylon rope. This black piece of tape is the area in the rope that I want to isolate, analogous to the disc herniation that I want to treat specifically. Because true spinal decompression, they often do say, I can treat your specific disc injury. Well, I'm going to show you why it isn't really possible the way they describe it. I have a rope tied right between 2 points. True spinal decompression says if I change the angle, I can change where my pull on the rope is. Doesn't look like I can. Oh, yeah, the pull's here now. No, it isn't. Just as taut there as it is anywhere else. The force, no matter which angle I pull from, is relatively evenly distributed between these 2 points where it is tied. Wait a minute, if I change the vibration of the pull, it'll change where the pull is. No, it doesn't. The force is still relatively well distributed across the length of this rope between the points that it is tied. What if I create a weak spot in that rope? Which is essentially a soft spot in that rope. Which is, if I could do that with a spinal decompression system, that would absolutely be beneficial to the area that is tight and compressed. If I want to decompress it, why don't I influence it, make it softer, make it more relaxed so it will actually decompress much easier? Or, physically described, why don't I treat the area that I want to be softer, and then no matter what pull that I put on it, it will be focused on the area that is softer. Let's see how that works. Spine, specific area I want to soften and relax, and our laser therapy. Now, laser works a lot more than just heat. It's not just heat. There are effects in the tissue that biochemical phototherapy effects that actually help healing, help increase circulation, help a number of different chemicals, help ATP, help energy to the cell, a lot of different effects. But just for the purposes of this demonstration, we're going to use a little bit of heat to soften and relax this rope while we pull it at the same time, because we want it to be focused on the area that we want it to stretch and relax at. Now that we've done that, look what's happening to this rope. Where it's getting softer, it's relaxing. It's starting to stretch. And now, oh, look at that. I just relaxed that one little area and it stretched a little bit more specifically right there. Not there, not there, not there. It did it exactly where I treated it. That right there specifically explains why treating an area, targeting the injury area with laser, helps that area stretch and relax and decompress more at that area than anywhere else down the length of the rope. This is the concept of robotic laser-enhanced spinal decompression. It's not true spinal decompression, but the term true spinal decompression, although it implies everything else is false, as you can see by this little demonstration, robotic laser-enhanced spinal decompression is just different. It's a different way to get a result of decompressing an area, to take pressure off a disc, to take pressure off a nerve, and to help rehydrate a disc. Because when you treat with laser, it also dilates, it also perfuses the disc with fluid to try to pump it back up again. You can see from this analogy exactly how that works. And there's no other system on the planet that can boast that type of effect, because no other system on the planet uses robotic laser-enhanced decompression to specifically isolate the area we want to decompress. So we're not true spinal decompression. We're better spinal decompression. If you want to use the new technology, you want to experience new technology, some of the old technology works quite well. It's helped thousands, tens of thousands, if not millions of patients and their families. We're introducing new technology. We've changed the game. Nobody's changed the game in 20 years. So if I didn't think it was better, why would I do it? Thanks so much for watching. Hope this explains a good analogy to you, and I look forward to speaking with you soon. Check her out.